Hi, and welcome to today's webinar where we're going to talk about a newer addition to TLS, which is TLS Select. TLS Select is put out by our division Nutrimetrics, which is a part of Market America down here in Greensboro, North Carolina. As a product brokerage division, it's been very exciting for us to easily move within the marketplace and bring you the newest enhancements to help with healthcare, to help with some of the challenges that we're seeing in healthcare. And everyone has done such a great job over the years with TLS. We've gained such notoriety in a good way with our health practitioners that they wanted something that they could use in even more of a clinical matter. So we'll talk today a little bit about just what is TLS Select, what goes into TLS Select, how would a practitioner evaluate if TLS Select is a good fit for their practice, and how would they go ahead and implement a program like this? My name is Sarah Tegender. I'm the National Sales Manager with Nutrimetrics, Custom Health Solutions, and I have been a proponent of TLS since, for about 10 years now. When I was growing up and I would stay at my grandparents' house, it wasn't uncommon for there to be cases of soda in the kitchen. I would wake up to the smell of bacon, and we'd have fried eggs, we'd have pancakes, and those are some of my best memories sleeping over at my grandparents' house. And, food is a really big part of just our lifestyle, culture, experiences here in America. And when my grandfather then had diabetes and complications from diabetes, I'll never forget, he was actually an amputee from diabetes. I'll never forget going and visiting Popsy in rehab when he first went to rehab after getting his leg amputated. And he had pancakes with syrup and orange juice as a diabetic, as an amputee diabetic. And I can tell you that that was the last meal that he had in rehab at the hospital facility that was catered by the hospital facility. We made sure of it that then we were bringing him high quality food. And it just blew my mind as to why were his caregivers, why did they not have a ready to go, a turnkey menu plan for a patient that presented with those sort of risk factors? And where else in our medical system is it failing? And I feel really strongly about the impact that we can have with TLS Select, and just making it a lot easier for our practitioners today to be able to put in some programs and make it really simple for them to have something with a very significant clinical impact. And so families know what to do, and that they can go home with what to do, what to eat, how to live, and a plan to go by. And so it's a really exciting time. It's an exciting time in healthcare because there's this new thing called population management, and it's a way that the insurance companies are now evaluating practitioners, specifically for reimbursement purposes. And there's these factors that they need to have when they are practicing. And there's things that they now need to do, assessments, counseling. And we have taken an approach with Nutrimetrics to parallel what these practitioners need to do in their practice anyways. We do it a little bit broader because with Nutrimetrics, we are business consultants. We're not just here to help with products and services. We're here to really help and come in with a comprehensive approach. It starts with defining the mission and vision, identifying program goals. And it's not until step 3 that we're really selecting the products and services, solidifying an implementation plan. But then we always go back to the patient base. Number 5 with population monitoring, patient engagement, and measuring outcomes, making sure if where we're setting our sights on, if that's the way that we're headed. And just like if you were going to, captain a ship, you could just be off by a simple degree and it would take you so far off course. And it takes, that captain to realize, when it's off course in order to be able to right the ship, make those tweaks and move forward with program recommendations. And at that time, then we can have some growth initiatives and we can do the process all over again. And so, in anything that we're doing, whether it's with our targeted supplementation or it is with something like our clinically supervised weight loss with TLS Select, we're always following that same process and that same mission. And so TLS Select was designed specifically with a health professional in mind. There's short-term results, which of course increases compliance with the patient, stickability with it, but it also is a really great long-term solution. I do have to say it was well suited for people that are working predominantly in a primary care setting, but it doesn't mean it's just limited to that. So in my experience in the field and in presenting this now for about 6 months to practitioners all over the country with the help of our nutrimetrics consultants, I can see that it is adaptable for just about any practice, clinic, and medical setting. But it was designed with the medical doctor, the osteopath, the registered dietitian, naturopath, nurse practitioners, as well as chiropractic doctors, allied health professionals, that are looking for an alternative to medicine today. And I just think back to my grandfather and to think about, if there was something in place, would his care, would it have been easier? Would it have been a little bit more turnkey for the practitioner? And would he have had, that stickability factor? Would it have been easy for him to understand, to consume, and to live a lifestyle like this? And I do think so, because I do see what we are doing with TLS Select in our practices today. And so TLS, if you've been on any of these webinars before, you know that we have our 4 pillars of TLS, and that has not changed with TLS Select. We still are following a low glycemic impact eating lifestyle. We're still focusing on improved body composition, whether that's through, some functional medicine, some physical therapy, some personal training, things like that, working out. We're focused on targeted supplementation. And, I think one of our most important is the education that we provide with TLS. Now we're pairing that with some additional components that are offered by our healthcare professionals: intensive counseling, blood panels, nutritional education, intensive behavior therapy. And we have the ability now to do genetics with our GeneSNP DNA analysis, pharmacotherapy, which if a practitioner is deciding to use pharmaceutical intervention, we can work that into a TLS Select proposal if that's something that they want to see. Hormone balancing where appropriate, physical therapy. And I think it is a team approach. I think that nutrimetrics and TLS Select work really well in setting up that referral network so the patient can be supported in multiple aspects of their treatment. What is going on right now in healthcare is the Affordable Care Act sets certain markers for what is considered, a clinically supervised weight loss program or weight management program. And these factors are things like intensive counseling. And so when we come in and we put a proposal together or we implement TLS Select, we're looking to initiate and train a qualified wellness coordinator who's on staff with the practice or the clinic. When the Affordable Care Act says, we need some sort of nutritional education, that's where we can come in with TLS and TLS Select with additional nutrition support material. With physical activity, that's where we can come in. The nutrimetrics consultant can help and bridge the gap by identifying and partnering with a qualified certified trainer with a 4-year degree or a physical therapist. When insurance companies and practitioners are looking for behavior therapy, again, that's where our qualified wellness coordinator comes into play. When they're looking for pharmacotherapy, we certainly can add that into a program if that's what they're looking for, or of course our targeted supplementation if that is an aspect that they also would like to incorporate. And genetics is a big thing. There's a lot of companies emerging. Genetics are now they're well accepted in the medical community as a great tool to be able to come up with comprehensive diagnoses, to be able to look at the patient in a different way like never before. And we have that with our gene SNP analysis, which is a big component of TLS Select. And I will go over some of the features and benefits of our gene SNP DNA analysis. Intensive behavioral counseling or therapy, according to the Center for Medicare and Medicaid Services, is defined as obesity screening using BMI. It's not uncommon now for practitioners to have in their office a Tanita scale, a Sacco device, some way to be able to take measurement of not just, how much you weigh and how tall you are, but also your body composition. Nutritional assessment is part of the behavior counseling. And then intensive behavior therapy to promote sustained weight loss, to include diet and to include exercise. And so if this is beyond how much time the practitioner can have with a patient, if this is beyond the scope of the practitioner's expertise, this is where it's really great to create an opportunity to network with either certified athletic trainers or physical therapists. Our Nutrimetrics health professionals all have a nutrimetrics.com website with a link to TLS. And so some of their patients are going to stumble on this little button, and they will then be linked over to our TLSslim.com site. Now, the difference is when they start on a nutrimetrics.com page and then they're linked over to TLSslim.com, under their patient login ID, everything then will be branded Nutrimetrics as appropriate. It's a great site with a lot of education. I'm going to show you some of the features of this site. The weight loss profile quiz is one of the great features. This is a free quiz. It's a tool that they can use. They can go through, fill out the profile with some of their goals, with some of their lifestyle factors. And then this will then be emailed to the practitioner for either the practitioner or the wellness consultant to be able to review the analysis. And then we'll come back with the weight loss profile with a recommended plan. I'll talk a little bit more about our plans, but this is a really easy way for a practitioner to, give the patient or client some homework, if you will, to start the dialogue about their lifestyle, about their nutrition, about their goals. It's a great way to be able to bring up some recommended weight loss supplements and start that conversation about how they can increase their commitment to their weight loss goals. This is very helpful as well because of our resources. They can log in, they can see educational videos, program downloads, ways for them to track measurements, body measures with some tips, a body fat calculator, some grocery lists. It's a great place for frequently asked questions, a blog. This does integrate with Fitbit also as well for some up-to-date information, and it will give some information about TLS Select, as I said, if they're on there. Now, I mentioned that nutrition education is a big piece that practitioners are looking for. And in my experience now with TLS Select, when I show them especially this TLS Health Guide and Journal, which can take a patient or a client day by day through the first 12 weeks to instill behavior, techniques, motivational tips, some healthy eating choices. And then this is a tool that the wellness coordinator can sit down and review with the patient or client. It's been unbelievable how practitioners that discover this health guide and journal completely, their face will light up, because this is a tool that they've been trying to hack together on their own. They've been trying to put together, well, where am I going to have a patient log or journal? Am I going to ask them to do it on their phone? Am I going to ask them to just, they're bringing in sticky pads and pieces of paper. This is a really impressive tool. The information in it is so solid. The practitioners are blown away by this. This is one of their favorite parts. I'm just going to go through some of the options then. Where would a practitioner, what are some of the programs that we can use? And these are the same if you're familiar with TLS and have been for some time. The first one is our new 21-day challenge. This is an infographic that we have about our 21-day challenge kit, the difference between the phase 1, the phase 2. This is a great really great eye-catching piece a practitioner can put in their waiting room. They can put it in social media, in email campaigns, to really get their patients excited about something that they can start today. 21 days, it's going to cleanse their system, going to help them get started on their weight loss journey. The packaging of it is also very attractive. This makes it simple and turnkey. It has everything in it, even the blender bottle. All the information is in there. A little mini 21-day journal tracking sheet is also in there. And when purchased through the Nutrimetrics TLSslim.com site, this will also be branded for Nutrimetrics. There's additional TLS resources. You can see here on the right side of your screen, there is a paper TLS questionnaire. If a wellness coordinator wanted to use a paper form instead of our online diagnostic, they can do that, and they can order these TLS questionnaires. Can also order, as you see here, some of our meal plans in a paper form. And so those can be ordered in the back office under unfranchised.com. I've seen these either given as resources to patients. I've also seen them displayed in the waiting room as sort of a what's that factor, for a patient to take. And then the practitioner, again, to start the conversation, could say something as simple as, did you take that for you or for someone else? And that begins the dialogue about weight loss and their weight management. Let's talk about some of the different plans that are available for practitioners to be able to use if they want something that's really simple and turnkey. So the first one being the 7-day detox. This is great for first-time TLS participants, prepares the body for the program, and can really kickstart weight loss efforts. Our fat shredder is for people who really are committed to short-term goals. It's a high-intensity 2-week weight loss regimen. It has a focused food guide. It's quick but intense, and you can expect to lose up to 10 pounds, during this 2-week program. Rapid results is a little bit more long-term. So this is something that could be more mid-range, a 6 to 12-week program for individuals who are serious about their weight loss goals. But the results are about 2 to 3 pounds per week on rapid results. Sure and steady, for people who maybe want to dip their toe into the water, ease their way in. It's going to be a little bit harder for them to get their lifestyle right on point for something like our rapid results. So sure and steady is there. You can expect to lose 1 to 2 pounds each week. All of these meal plans and guides are 2 pages, and they have all the information that a wellness coordinator would need to give the patient to be able to explain these. Continued commitment is for once you've achieved your targeted weight loss goal and you want to continue the program to maintain your weight, to maintain the healthy lifestyle. Now, we all know that there are some people who can't cook, don't like to cook, or really just shouldn't cook, right? And our Nutrimetrics health professionals also get a shop.com website where they can link over to some of our preferred partner stores. One of those being Bistro MD with 6% cash back for the patient or client and 6 IBV that will be paid to the practitioner, awarded to the practitioner. And TLS also has a great download for Bistro MD to go through and see which ones are approved Bistro MD meal plans for whatever menu plan that patient or client might be on. So whether it be Fat Shredder, Rapid Results, Sure and Steady, this is a really great tool. These tools can be found both on tlsslim.com as well as on unfranchise.com. Another one is Chef, and so where Bistro MD is more, oh no, they both are. They're meal kits, and then the patient or client can cook the meals at home with the recipes. So Chef is another one. This is where there's either some famous meal plans or famous chefs that put together some programs here. This is at 2% cash back and 4% IBV from award-winning chefs and restaurants. And again, we also have a download with TLS approved chef meals. This makes it very simple for patients and clients to be able to use these partner stores as well. Additional resources that are available for Nutrimetrics. The Nutrimetrics brand can be found in the Print Center. This is a Weigh the Facts brochure. You can see it has both our Nutrimetrics and our TLS logos on there, as well as the Eat Right, Not Less brochure. We have a lot of different tools that just make it very simple for a practitioner to be able to introduce this program to their patient or client. I think also to take a tip just out of branding in general, sometimes the wellness dialogue just starts in the overall feel of the practice. And I'll go through some examples about what different practices are doing. But there is definitely a benefit to some posters and to putting things just to start that tone, even from the time when the patient walks into the office, sits in the waiting room, and takes a look around. And so we do have TLS product posters, a testimonial poster, the one here that I have, the glycemic impact infographic poster, which is definitely a popular one. And whether this is being used, like I said, in the waiting room, it might be used in some counseling rooms or in some exam rooms. I always recommend that these are framed and professionally displayed in the office. A lot of times our Nutrimetrics consultants will take care of that, of getting them ordered, getting them framed, getting them downloaded. We have a lot of great infographics as well. There's a lot that is available right on downloads on unfranchise.com under support materials, TLS, and sales aids, and you will find those. So these are all appropriate for, whether it's TLS or a TLS Select program. Some of our practitioners, I just am going through, this is an example of our infographic for green tea coffee. Some of our practitioners are just looking for something that's very turnkey, something that they can just say, this is Dr. Sarah's weight loss program and it's powered by TLS. And so TLS is, this is where it is, and then I will put together some sort of program, and I'll show you how that works. But other practitioners are just saying, this is Dr. Sarah's Slim Down program, and you're taking our tools, our information, but then really branding and changing the marketing so it is more personalized, it is more labeled just for them. And with TLS Select, that is totally appropriate. It's appropriate for practitioners to select, which of our meal plans they like, maybe which of them are not their preferred meal plans, which of their targeted supplements they want to add, which ones they want to leave to the side. And so when we added this together, the whole purpose is for us to be able to present to a practitioner, this is what we have available. You can take what you want, you can customize it in any way that you want, or you can leave it just as it is if you're looking for something that's a little bit more plug and play, a little bit more turnkey. And this is going to depend on the level of commitment. This is going to depend on the amount of staffing that the practitioner has available to them, the amount of space that they have in the office, and of course, the commitment that the patient has. The reason, though, why we did come out with TLS Select is because there's a lot of competition. There's a huge demand in the marketplace for physician weight loss programs. Whether we look at something like a Physicians Weight Loss Center, which is an online weight loss program with 6 programs, following some diet guidelines and from the U.S. Agriculture and from the American Heart Association. There's a very low calorie, a thermogenic, a low fat, high energy. So there's a few different types of plans that are available for practitioners. Weight Loss, 4 to 6 pounds can be expected to lose up to in the first week. 14 pounds can be expected, losing up to 14 pounds in the first month. There is a blood test, body composition, EKG, nutrition counseling, website, supplements, medication. It's a 3-phased approach. Medifast has been around since 1980. This is a portion controlled 6 meals a day, and at the price point of $3.99 a month, but there are customized plans that are available. The health professional has 2 options: Take Shape for Life, which is their new direct sales division, and so other select medical providers may be able to distribute wholesale by case lots, qualifications, so only certain practitioners have access to this program. And Metagenics, again, we just picked some examples of ones that we've been hearing in the field. They have the first-line weight loss therapy with their transformation program. They have a 12-week guide, 30-day supply of supplements, protein shakes, and bars. The point in just bringing up some of the competition is just to show you there's a huge market out there for something that is a physician weight loss program. And in instances, I've also seen where we've come in and we have met and oftentimes exceeded physicians' expectations as to what is out there, what's available for a clinically supervised weight loss program. We're right on target with competitive programs with what we're offering at attractive price points, considering that it is customized for the patient base, for the level of commitment. So I want to go through just what would a practitioner put together as an offering for their patient or client base. I want to start with what I like to call just the whole enchilada. What would be the most comprehensive program, that I could conceive that we would be able to put together. Knowing from there, we can of course scale down. So like I said, I'll give you some options from there. But I would say that the biggest package here would look like maybe a 13-week program. 13 weeks, because it would start with week 1 as maybe our TLS detox phase, followed by 12 weeks then of intensive behavioral counseling. This would include physician's visits before and after. Where appropriate, it could include blood work. Body composition analysis, again, before and after. Weekly counseling, either as individual counseling, if again the practitioner has staffing for that, or group sessions when available. The practitioner might decide to do 4-week measurements in inches, weight, blood pressure, and they would put together a whole package with TLS products, a guide, a website, and gene SNP DNA analysis. At Nutrimetrics, we've just made some recommendations, again, where appropriate, where a practitioner might want to run a complete blood count with different metabolic profiles, which have liver, kidney, salt, water balance labs. They might want to do something like homocysteine. They might want to do leptin. They might want to do iron. They might want to do total blood histamine levels. So these are just our recommendations of, some possibilities of where blood work could come into play. But what would the process go? What would the flow be like in the office? So we really like to take the objection of that there is no selling needed. This is really just for the practitioner to do what they do best, which is see the patient and identify some risk factors and make appropriate recommendations. Practitioner would simply complete a patient care visit. And if that patient's identified as exceeding a BMI of 30 or having 50 to 100 pounds of weight to lose, or even some other comorbidity factors. Where appropriate, fertility might be a concern. Stress and anxiety might be a concern. Sleep might be a concern. Some endocrine disorders might be a concern. So depending on the scope of the practitioner, those comorbidity factors might also come into play to have the health professional go ahead and make the recommendation of a weight management program. At that time, the health professional can invite the patient to view. We have two different videos, whether it's for TLS or TLS Select, two different videos. They could view that right there in the exam room. They could go into a private room. Again, this is for our consultants to figure out, based on a clinic walkthrough, what makes the most sense for the flow of the patient through that office. The video would explain the 13-week program, and then we have some different options on how they would enter the program. This could include the total 13-week package with or without GeneSNP. It might be the 21-day challenge kit. It might be a 6-week package. The patient will then take a TLS Select information folder that has all the pricing. And at that time, either at checkout, the wellness coordinator, whether this is a medical assistant, a registered dietitian, or another qualified individual who's identified as playing the role of the wellness coordinator within this practice, will just simply ask the patient if they wish to enter the TLS Select weight loss program. It'll be up to the practice whether it's something that is a rolling admission or that has maybe a monthly or quarterly start date to it. So what would a full 13-week package look like? Well, it might have something like 3 TLS core, knowing that if this was a 12-week program recommendation, that would take them through the full 12 weeks. 6 TLS nutrition shakes would take them through the full 12 weeks. They would only need 1 TLS health guide and journal. A 90-day multivitamin might be the recommendation, 2 isotonic 90-serving OPC3s, and 1 90-serving activated B complex. They also then will have access to TLSslim.com, the education videos, the resources, the downloads, the Fitbit integration. That's all there and also available for them. Now, what is the benefit to adding GeneSNP analysis into this program? Well, what is it? First of all, GeneSNP analysis, it's a simple cheek swab that the practitioner will take in the office. They'll send it to the lab, and the lab will send back to them a patient guide that's going to have an analysis of 48 genes and 61 SNPs. 22 of these SNPs are related to obesity. The different panels is the general obesity index. So this is a scale of 1 to 10. This does not show if the patient is obese or is not obese. Of course, you're going to want to do that from things like height, weight, measurements, body fat percentage. But what this is really going to show is, does this patient present with risk factors that can be turned on or turned off by diet and lifestyle intervention? And where does their risk factor, where is the risk on a scale of 1 to 10? The food choices, exercise and activity levels, just general health, whether this is metabolism or inflammation, behavior, whether this is anxiety, stress, sleep, and vitamins and vitamin utilization, and where targeted supplementation might be appropriate in turning on or off some genes. It's a great way for personalized medicine, lifestyle medicine, functional medicine. It's a way to customize the patient or client's health. It's based on the understanding that nutrition plays a significant role in preventing chronic diseases. And this is a great way to be able to pinpoint the patient or client's unique gene variations and how they're affecting the body. And so our new GeneSNP DNA analysis program, because Nutrimetrics has offered other ones previously, but our new one is showing more genes, more variants, and we also paired this with a much more comprehensive practitioner guide and product recommendation guide. The flow of it is much more clinical in nature than any other kit that's out there. Makes it easier for the practitioner to go through and use alongside other diagnostics that they have available to them, such as just something as easy as a patient history or blood work, risk assessments, things like that, in order to come up with a very comprehensive diagnosis, a very comprehensive lifestyle, diet, nutrition plan for the patient. This can reveal insight into plasma levels, hypertension, insulin resistance, anxiety, mood disorders, or eating. The use of personalized diets can help prevent or delay the onset of disease and optimize and maintain human health. And the nice thing about this gene SNP DNA analysis is that there is no age limit. So you can use it on individuals under the age of 18. This one goes through environmental factors like sleep or stress, where really changing diet might not help that patient as much as changing sleep habits or controlling or mitigating stress levels. For a patient that comes in for a practitioner who just has really struggled with weight, is it not just looking at the food they're eating, but looking at something like their genetic propensity for insulin resistance? Are we looking at fertility as an issue? Are we looking at mood, mental performance? It's a really novel approach to the way that health practitioners can look at the clinical impact of genomics and making recommendations for their patients. We have some great marketing tools, whether it's infographics, downloads, meet-ons, things like that. This is a great way to be able to manage patients' health and possibly prevent, mitigate, or delay the onset of chronic and age-related diseases. Now, this is what it will look like. It'll give the gene name. It'll tell what the gene does. It'll tell which variant that the patient presents with, and then the impact or the clinical implication. There's 9 key diet and lifestyle action areas with this. To make individual dietary recommendations, to produce dietary supplements to enhance, an individual genetic potential, and to produce dietary supplements to suppress gene activity. This is a test that can be done at any point in the TLS Select process. And then as a patient maybe is not responding to a certain menu plan, certain lifestyle, the practitioner or the wellness coordinator can go back into the gene SNP, go back into those results and to see where there might be some additional risk factors, some additional things that do need to be tweaked in their recommendations. There's consistent evidence, scientific strength. It's really integrative with the evidence that it has. There's a lot of different, it looks at hypertension, for example, but it looks at hypertension and, is this an issue because of diet? Is this an issue because of, salt in particular, or is that not the risk factor? So the services and treatment, it gives you a lot of different access to be able to look at that patient and look at where the risk is. It's professionally priced at $39.95 from Nutrimetrics or $150 for a kit of 5. The practitioner is then balance billed from the lab for $265 at time of processing. Our suggested retail is $495, but of course this can be packaged into one of our TLS Select programs as well, and for like a total price. But what other things are available for TLS Select for training and marketing materials? We'll just go through these quickly. There is a customizable TLS Select trifold brochure. A lot of practitioners I'm seeing are getting these professionally printed. They then might be dropping these off in their community with some of their referral partners. They're putting this in the waiting room, or they're using this as a leave behind for the patient to be able to evaluate the TLS Select program. There's a 12-page patient overview that gives a little bit of information about TLS Select, about low glycemic impact eating, gives an example of one of our menu plans and recipes, and talks a little bit about our targeted supplementation. These I'm seeing are being used in the counseling rooms, in the exam rooms, as patients are evaluating the TLS Select program for whether they want to choose to enroll or not. practitioners are getting these also professionally printed, professionally bound, or the nutrimetrics consultant is doing that for them. They're leaving them in their waiting rooms, maybe not necessarily as a take home or leave behind for the patient, but as a tool where they can pull something out and show some examples of what the TLS Select program looks like. Again, all branded right for their practice. So it's a really great 12-page document. We have a video on TLS Select and just TLS, depending on, maybe a patient wants something that's a little bit more self-directed, and I'll go into that as an option, and they just want to know about TLS. Maybe they don't need that clinical supervision. They just have a couple pounds to lose. Maybe it's an upcoming vacation. Maybe it's an upcoming class reunion. It's just, 5 to 10 pounds. They need to jumpstart something or get themselves back into shape, as opposed to having that intensive behavioral modification in that therapy. And that's where TLS Select comes in, where a practitioner is also pulling from, what other things can they offer within the scope of their practice? How can they make a really comprehensive practice and comprehensive program, comprehensive tools that they can package together, whether they just, keep it with the name of TLS Select or brand it for their own as the practitioner or as their practice, so maybe like I use the example, it could just be, Dr. Sarah's Slim Down program, something like that. And it's a clinically supervised, weight loss program. There's a Meet Your Wellness Coordinator download. This is really great. It's easy to edit and customize, so whether this is someone who's a qualified wellness coach on staff, a qualified health coach that's on staff, an on-staff nutritionist or registered dietitian. You can pop their picture right in there. This can be something that's displayed in the office, that's displayed on a website, and it gives some really great information with the photo, the bio, and the contact information. We have program options where practitioners, this is something where they can then put what the price is. So as the patient is evaluating, and this is something that they can receive to figure out how much each program option is going to be priced at. And here's another pricing sheet so they can put together what is going to be included in the program. So this gives some really great examples. I always suggest that people look at this download when they're trying to put together their clinically supervised weight loss program. How many of each of our supplements? Are there any additional supplements? And is there any other are there any other disciplines of the practice that will be included? So like these physician visits, like maybe physical therapy where appropriate. Maybe, a practitioner has a massage therapist on staff, and that's something that they want to include. Maybe they want to include blood work. They want to include pharmacotherapy. They want to include either group classes or individual classes. What is going into the total comprehensive program? And so we have a couple different forms here, however they would like to present that to their patient for them to be able to do an analysis of what the program entails and the cost associated with that. So what would this look like? Again, every patient and client is going to have a different commitment to health, a different timeline, different goals in mind. And so what would something that's, we in Nutrimetrics, we teach our Nutrimetrics consultants to follow what we call a small, medium, and large size format. So just for illustration purposes, this morning I went to Starbucks, and this morning my level of commitment to my caffeine might have just been a tall coffee. I was like, I've already had a coffee, this morning while I was getting ready, and I just needed, another small tall coffee just to get me through, the second half of my morning. But on other days, because I also am a mom, other than just being the national sales manager with Nutrimetrics, and for any other parents that are out there, there are some days that it is just a venti commitment to my caffeine levels, right? I am more committed. I am willing to pay more money for the bigger package, the bigger coffee size at Starbucks in the morning. And I mean, I just use this example so you can see, I mean, these levels of commitment are going to change depending on the goals, depending on the patient, depending on the price that's there. And so how do we do this, in with TLS Select as well? So a small example might just be a self-directed program. It might be just as simple as a practitioner saying, we have available a 21-day challenge kit. We have the boxes right here. You can take this home with you. You can follow this. Of course, you can come back and call if you have any other questions. But for the most part, with the information there, with what's on tlsslim.com, this is going to be able for the patient to be able to follow their own self-directed program. They might also just use one of the simple downloads, our menu plans, something like that. And that is perfectly acceptable as part of, TLS Select, where it is under the supervision, under the guidance, under the umbrella of our, health practitioners. But it's a small integration with TLS. A medium integration might look like something that has education sessions included in the practice, space permitted, or at the wellness center. The wellness coordinator who's on staff might do some of the coaching, some of the product recommendations. This might be a 4, 6, or 8-week program. This is something that is much more comprehensive in the scope, a little higher in the pricing, where something in the small range might be priced, under the, maybe up to like $200, $250. Something in the medium range might be more like your $500, $600, package, something along those lines, depending on the demographics of the patient and what's included. And a large integration might have more like 12 weekly TLS education sessions. This might be, a whole full 12 or 13-week program. This might have a group potluck meal at the end where everyone's bringing a new favorite TLS-friendly recipe. This might have more of a physical therapy component combined into it. It might have some additional diagnostics, some additional patient visits, some additional counseling, blood tests, things like that from the practitioner. It can make it very comprehensive. Look at, here is one of our Nutrimetrics health professional teams teaching their patients healthy cooking tips in a working kitchen that they had access to. Lots of fun. I mean, this can get really exciting. This is a health professional taking our patients on a grocery store trip, showing them how to read labels, introducing them to options for healthier grains, much more comprehensive. And then this here is, whether in this large package, we're adding in GeneSnip and the counseling of that, or we're leaving that up to the patient for the option. And so where can you learn a little bit more on how to integrate TLS and TLS Select into healthcare practitioners' offices? With Nutrimetrics, you do have to become a Nutrimetrics consultant in order to be able to work with health professionals under our system. And so we recommend that you go to our next Nutrimetrics consultant or health professional training. So what we have available for 2016 on the consultant side in September, the 23rd, 24th, and 25th in Richmond, Virginia, and October 21st, 22nd, and 23rd in San Diego, California. If you're a practitioner and you're thinking about, well, I would like to learn a little bit more about the products, I want to learn a little bit more about implementation, it would be appropriate for you to join us in Richmond in September for our 2-day health professional product and implementation training. If you want to learn even more about the science of our clinical ingredients in the products, it would be appropriate then for you to join us on October 22nd and 23rd in San Diego, California. And that is our NEI training through our Nutrimetrics Educational Institute. And that training will offer CME and CEU credits where appropriate. And you can learn more about that course at nutrimetrics.org. You can head to nutrimetrics.com for all the other ones to be able to learn about our Nutrimetrics system as a whole, and to be able to learn how to go into and work with health professionals to offer this program. I'm really excited about the next few months with Nutrimetrics, with TLS Select, with GeneSNP DNA analysis, as we continue to come out with more tools to make this much, just to continue to help with the ease of integrating this into a clinical setting with our practitioners, to work with our consultants, our TLS coaches, in working with their practitioners into fully integrating this, to work with our wellness coordinators, our staff. It's been very exciting, the results that we've seen. We've seen practices who have finally found a solution, and there's one that I work with from a corporate standpoint, and she's getting noticed from colleagues. People are sending many more patients to her because of this tool that she's added into the practice, where she is able now to bridge the gap where she couldn't before with such a comprehensive weight loss program, where she's creating a niche for herself. She's being known now in our community for having the solutions, for having the tools, for building in the time and the resources to working with and helping our patients. And when I think back to my own family, when I think back to my friends and my own personal health, I am so excited that there's tools out there like Nutrimetrics, TLS Select, GeneSNP DNA analysis, where we really are changing the face of healthcare, one practitioner at a time, through our revolutionary technology, through our turnkey systems, and through the education systems that we have through Nutrimetrics and our Nutrimetrics Educational Institute. I hope that you would join us at a upcoming 2016 training, whether it's on the Nutrimetrics consultant side or the health professional side. I know I would be really excited to work with you on the implementation of TLS Select into your practices. Again, my name is Sarah Tegender, National Sales Manager with Nutrimetrics, and I hope that I can help make this your most efficient and effective year yet with Nutrimetrics.